So, hello, namaste to all of you present here. Hi, my name is Yaashi Mirchandani, and I am here to present you a small presentation on the topic health insurance. So, many of them would be thinking, like, what is health insurance actually? Let me give you a small and a basic definition of what health insurance is. So, health insurance is a type of coverage that helps an individual and families pay for any medical emergencies. It is a contract between the insured person and the insurance company where the insurance agrees to pay for all or a portion of the insured person for the any medical cost in exchange for a regular premium payment. Okay, so now let me tell you that what health insurance and what are the type of health insurance plans are available, including the employer, individual, joint, family, and everything. So let's explore the world of health insurance. So health insurance is just not a necessity, okay? It is a life savior. It provides peace of mind by covering the expenses during any medical emergencies. So now insurance, health insurance is important. You will know why. So as I mentioned that you will know that why health insurance is important. So I will categorize it into three different categories. First, the medical emergencies. Why do you take a health insurance? You take health insurance just because for the medical emergencies, right? So health insurance provides that financial support in terms of any medical emergency and experiences, giving you the peace of mind and obviously the reduction in stress. Second point, family protection. Why do you have health insurance? So that you can overcome the unexpected medical expenses, right? Also, it ensures that you can receive the best care of illness and prior before any treatment you can get it. Third point, the preventive care. What is preventive care? Health insurance covers a preventive care services like the annual checkups, the screening, the blood tests, the vaccination, and also it can save lives by detecting illness before time. You can meet your doctors and also you can provide the reports which are provided by the health insurance. Moving forward, different type of companies have different type of health insurance, right? And here I'll be explaining the four types of health insurance in general. Okay, so first is the indemnity plan. You can see it allows you to choose your care provider. What do you mean by care provider? We always have a nominee, right? So it allows you to choose who will be your care provider, and also it covers a specified percentage of the total medical expenses. For example, if the total medical cost is for rupees 3 lakhs and the insurance is been providing 70% of it, so you will receive the 2,10,000 rupees amount, right? Moving forward to the second type of insurance, that is health maintenance organization, that is HMO. Okay, so it provides a network of healthcare providers to choose from. You can choose your healthcare provider, and also it covers the full expenses for the services offered by the network providers. It will provide you all of the expenses that have been occurred in your medical emergency. So the third is the preferred provider organization, that is PPO. It offers a large number of network of providers, but it covers only a partial amount of expenses. That is also for out network care. For example, if I say that your amount was for 3 lakh rupees, right? But it will provide you only some partial amount of that. All of the medical expenses that is occurred, it will provide you only a partial amount, which will be mentioned in your deed before you would make the deal for the health insurance. The fourth, point of service, that is POS. Okay, it allows you both in and out network providers, and also it gives you a primary care physician who makes referrals to you specifically according to your disease or according to your illness. So moving forward to the pitching health insurance. So what am I doing here? Am I pitching you any health insurance? No, not exactly. I'm just telling you what is health insurance. So how to pitch your health insurance? Firstly, you have to tell them the benefits. You have to highlight the benefits, right? The coverage offered by different insurance plans to cater their needs, right? What the customer needs, you have to fulfill them. Secondly, how you will identify the prospective customers, how you will reach out to those customers who need your health insurance, right? You have to identify the basis of their needs, their lifestyles, their income, how much they are earning. According to that, you have to give them that health insurance that might cover their expenses, right? After that, you have to handle the objections. What objections? For example, if I say that the customer's objections concerns by understanding their queries, like with empathy, or by suggesting them some solutions. For example, if a customer says that my salary is 18,000, right, and you are pitching them a 15,000 health insurance, how you will satisfy their needs, how you will satisfy their queries, their objections? Simply what you will do is that you will apply some methodology, some statistics that you can, that they can provide us and give us a 200 rupees monthly or like a weekly charge, and then they can continue to the health insurance. Simple, easy. Now the very easiest part, the part 4, close the deal. How you will close the deal? You will provide assistance throughout the online application process, or either it's an offline process, you are explaining them, or once they have the better understanding that you have for the sale, and ask for the sale, and you will seal the deal. Simple. It's that simple, right? Now obviously you have to learn some strategies, the effective strategies for convincing sales. You can't say like, okay, this is the health insurance and this I have to like sell to you, sir, would you like to take it? No one would take, right? No one will never take. So this also have some steps, like 4 steps. First, you have to understand the customer. As I told you in the previous slide also, you have to understand the customer need, the customer want, and also you have to understand how the customer will react to your insurance, right? Okay, so you have to take the time to know your customer first, understand their needs and the budget in which they can allow the health insurance to be taken. In low key, you can also provide them the best health insurance plan according to you, according to your understanding, what you feel that the customer is needing exactly. Second point, you have to show them the value. What value? Which value? You have to clearly explain the health insurance, the coverage, the benefits, the terms, the plan, and what the health insurance includes in it. For example, the OPD charges, the ambulance charges, and all the benefits with the specific notations, right? Third point, listen and connect. You have to listen if you have to understand the customer need, right? Then you have to connect it. For example, if the customer is telling you about his salary, about his income, first you have to understand, okay, this person is earning this amount and now I have to give him health insurance in some range. For example, he is earning 20,000 per month, so you will definitely give him an health insurance in a very minimal range, right? So you have to empathize it with the customer concerns. You have to provide the solutions and also help them understand the insurance plan. Also you have to make them the right decision, right? You have to build an emotional connect with them so that they can connect with you, and obviously they can trust you and buy your health insurance, right? And the last, which you have to be confident. If you won't be confident, they won't buy your any product, right? They won't be buying your any product. You have to be confident while presenting your plan, especially when you are telling them and addressing them any objections. If you are telling about the health insurance, that our health insurance doesn't include OPD charge, for example, so you have to be very specific about it so that they don't face any problem in the situation of any medical emergency, because that will lend to an higher chances of not deal done. Okay, so you have to be very particular about it. So lending to a higher chances of making a sale, you have to be confident. And like by seeing my slide, okay, Yashi, you have to stop it, it's done. No, so you have to also like seriously overcome these common objections which customers will arise up to you. First it is too expensive, I am already covered, I don't need it. You have to overcome this. You have to explain why they need it, why it is expensive, and if they are covered, so why your health insurance is very much particular and good for them. First I'll explain you, it's too expensive. If someone says you it's too expensive, you have to show them the value of the plan. Okay, you have to explain the cost that can be managed, how it can be managed. You can tell them that how long term it can save them the money from any medical expenses, right? After that, I am already covered means they have already been into a medical or a health insurance. So you have to explain how the current plan may not provide the coverages for certain conditions and events. You have to make the plan that can provide more and better coverages for them. For example, many of the health insurance doesn't provide some specific things, but your health insurance might do. You have to tell them, right? That is the basic thing. You will make them know that yeah, our health insurance is giving you some particular things like OPD charges, balances, the ambulance charges, and all of the medical facilities, the tablets, like some of the health insurance doesn't include it. Okay, so you have to be very specific about it. You have to tell your USP, your health insurance policy. Okay, you have to be very clear and particular about it. I don't need it. Why do you don't need it? Like, why the customer don't need it? Simply, you have to explain the advantages of the of having the health insurance for cost control, like for the preventive care, and also the coverage, emphasizing the peace of mind it brings. Obviously, if I fall sick, for example, and I have to get admitted in hospitals for around hospital for 5 days, I will have to bear the charge of 5 days, and it could be something around in lakhs, right? Because in today's world, medical line is so expensive. You can't even imagine that how much it will cost for a normal surgery, right? So you have to be prepared for it. So, and you have to be very clear about the things that include that the whatever the diseases it include in your health insurance policy, like pregnancy, and does that include, you have to tell that. Okay, a customer would not hear you until and unless you are hearing them first. Okay, so you have to build that empathy and trust, and obviously you have to thank the customer that they are listening you, and obviously thank you, all of you, so that you are listening to my health insurance script. Okay, so firstly I'll tell you that active listening. What is active listening? Like, if you are listening to me actively, I'm continuously saying a statement, that is, you have to be clear about your particular policy. You have to be clear on your pinpoints that you are providing to the customer, right? So this is my view of health insurance. Firstly, active listening, what it includes is, you have to listen to the customer needs and provide them with the personalized plans and solution. A customer who is a diabetic, okay, for example, he needs a regular checkup, he needs to go to the doctor once in a month or like that, so he will acquire the OPD charges from you, right? He will expect the OPD charges from you. So that is that customer need. Okay, so you have to detect that, and you have to tell that policy to him or her which he needs. You have to fulfill his needs. Okay, right? Then you have to build a empathy and trust for the customer. Obviously, if there will be trust issues, the person will not trust you, and won't buy, he won't make a deal with you, right? Because you have to build that trust, and you have to give them the assurance of a secure medical expense that you will provide in terms of any medical emergency. Third, you have to thank the customers. How you will thank the customers? Obviously, you have to thank them for their business. Like, you have to try to build a long-term relationship with them by following up regularly. Like, if once the deal is done, it's not like that you have to forget them. You have to call them once in a while, so that they can be attentive to you, and they know that okay, they are having some medical insurance, some health insurance with them. Let us know some benefits of health insurance, which is literally a must to know. Okay, so first of all, it is the financial protection. Obviously, there is a financial protection if you have a health insurance. You don't have to hustle for like an immediate income or immediate source of income at that particular point of time when you need it in a medical emergency, right? After that, second point is access to quality health care. Because you don't have money, you will opt to choose some of the hospitals which are not having a particular good facility, good medical doctors, like that. But if you're having a health insurance, you will choose a good operation, or you will choose a good hospital or a doctor, right? Because you won't have to hustle or take a tension or a stress, like you have to pay this much or something like that. You will be secured for in that part. Okay, so third point is the coverage for major medical expenses. You know what are major medical expenses, right? Like chemotherapies of cancer are not included, right? But if we have to take a urgent surgery, like any surgery you can say, so that would be covered, like it is a major coverage for the medical expenses, right? For the fourth point, family coverage. Yeah, some of the health insurances provides family coverages. That is, if one single person takes the health insurance, but obviously it would be varied from prices and the ranges, so that you have to be like particular about it. And yeah, they covered the family coverage also. They provide health insurance to the families also, but not as per the insured person is getting. Not all the facilities which an insured person is getting. That's it. How you will close the deal? Simple. Okay, bye, thank you, sir. No, not like that. You won't do it, because you have to be proactive in providing help assistance throughout the process. Once the process is done, you have to make the purchasing a health insurance plans a seamless experience. The customer of yours who has been finalized to take the health insurance should be that customer should who would go to other people and suggest your company for the health insurance. Then that's what you made your trust. That's what you made your company at best in his mindset. You have to do it like that. That's what called the close. So that was my explanation to health insurance, and I hope you all would like my a little brief introduction on health insurance, and I would really like to indulge into or other products and other topics. And yeah, let's meet in another video. All of you, best of luck. Thank you.